Hello everyone, my name is Ameer and I will be discussing on the topic about the consumption of alcohol while on insulin medication. First, we need to talk about the basics of this video, beginning with drug-food interactions. Drug-food interactions refers to an interaction between a specific drug and food in which the combination changes how a medicine works in the body. These interactions either increase or decreases the effectiveness of said medicine. Investigation into this interaction is very important as it can cause some unwanted side effects. Next, we will be talking about the substances involved. Insulin, in its natural form, is a peptide hormone that is released by the pancreas for the purpose of regulating blood sugar levels. This is done by increasing the uptake of glucose in the body cells, in addition to converting excess glucose into glycogen and fatty acids, such as triglycerides, which is stored in the liver for later use. In its synthetic form, insulin is a medicine that is administered by injection and commonly used to treat blood glucose-related illnesses such as type 1 and 2 diabetes mellitus, which is the abnormal elevation of blood sugar levels, and hypoglycemia, which is abnormally low blood sugar levels. Insulin is secreted as either bolus insulin or basal insulin. Bolus insulin is insulin that is secreted as a response to elevated glucose levels from the digestion and absorption of carbohydrates, while basal insulin is a constant stream of insulin, which is most noticeable in between meals or at night during sleep. In the market, there are 4 types of insulin offered: rapid-acting, short-acting, intermediate-acting, and long-acting insulin. Meanwhile, alcohol is a psychoactive substance, meaning a substance which alters psychological functioning by inducing effects on the central nervous system. Alcohol also affects whole body metabolism. The table below shows one of many examples of illnesses caused by alcohol. Now, we will talk about the mechanism of interaction between insulin and alcohol and how alcohol affects the insulin's pharmacokinetics, or how alcohol affects the body's processes on the insulin. First, we will talk about the absorption. Alcohol causes vasodilation of blood vessels via smooth muscle relaxation or inhibition of the sympathetic nervous system. This increases the absorption rate of insulin. For distribution of insulin, alcohol generally does not produce any significant effects. However, if the alcohol causes dehydration, the plasma volume in the blood decreases and as a result reduces the insulin concentration in the blood. Alcohol affects insulin metabolism in many ways. The most important being that alcohol will be metabolized first, as alcohol is a toxin and has no way of being stored in the body. Thus, the liver will shift focus from regulating other hormonal systems to detoxifying the toxic substance, which reduces gluconeogenesis, the production of glucose, in addition to reducing insulin degradation and clearance. As for the second point, alcohol requires enzymes such as alcohol dehydrogenase for breakdown. These reactions uses NAD+, a coenzyme which is vital for other metabolic functions. For excretion, alcohol does not produce any direct effect. However, chronic alcohol use will slowly damage kidney tubules, resulting in various deficiencies, such as decreasing its reabsorption and filtration capabilities. As a result, insulin is circulated longer in the blood than normally, but insulin reabsorption is also reduced. We will get back to that point in a minute. Now, we will talk about the clinical consequences of insulin and alcohol interaction. The first being delayed hypoglycemia, which refers to low blood sugar levels caused by the delayed release of insulin as a result of alcohol being metabolized first, and the prolonged insulin action as a result of extended circulation of insulin. The impact is most commonly observed on basal insulin levels. Next is insulin resistance, which refers to the reduced effectiveness of insulin due to lowered sensitivity of receptors in body tissues, as alcohol also damages body tissues. This illness is much more severe as the reduced insulin sensitivity means there is less uptake of glucose, which can lead to hyperglycemia or elevated blood sugar levels down the line. Now, let us talk about advices to give to the patient regarding this interaction. First, the patient should avoid drinking during fasting or drinking without eating, as their blood sugar levels will be especially low during this time. Second, they should monitor blood sugar levels before drinking, sleeping, and overnight to check for potential hypoglycemia. Lastly, medical professionals should teach patients on how symptoms of hypoglycemia can mimic intoxication, as alcohol produces many symptoms identical to hypoglycemia, such as lightheadedness. To end the video, here are the references that I used for the making of this video. You may read them at your leisure if you wish to gain a better understanding of this topic. Thank you for watching and have a nice day.